these are from BSN1A. So today I'm going to do the positioning and draping. First is horizontal recumbent or supine position. So the purpose of these are general physical exam, various operative procedure, male catheterization for comfort by providing a change of position. So first is have the client lie on his back with the legs extended to relax the abdominal muscle. Lie on your back. Second is to place a pillow under the client's head on the lumbar curvature and another one under the lower extremities for support. Okay, ma'am. Third is to footboard should be provided if the patient would be on this position for so long. Arms be crossed on the chest or lie loosely on the side of the body. Here or here. Then fifth is put the sheet over the patient's covering the body completely from the neck to the shoulder downward without tucking it under the patient. B is dorsal recumbent position. So the purpose of these are vaginal examination when bedpan is to be served, pelvic examination, operative procedure of vulvar areas, and for female catheterization. First is assist the patient to lie flat on his back. Okay. Then second is to separate the leg, flex the thigh so that the sole of the feet rest on the bed. Okay, ma'am? Okay. Then, third is place the arms either above the head or flex with the hands on the chest. Okay, over here. Okay. Then, fourth is place one pillow under the client's head. Okay, ma'am. Then, fifth is bring buttocks of the patient at the edge of the bed. Then sixth is put the draping over the patient, covering the body completely from the abdomen downward to the lower extremities. Okay, then put this. Letter C is dorsal lithotomy position. So the purpose of these are for cystoscopic examination, operation of and examination of the perineum, vagina, cervix, bladder, and rectum. Third is normal spontaneous delivery. First is assist the client to lie on his back. Then second is to separate the legs and flex the thigh deeply toward the abdomen. Elevate the lower and support them with the stirrup. Okay, third is bring the buttocks to the edge of the table or a little beyond. Okay, fourth is raise the arm above the head or flex them with the hands on the chest. Okay, over here or here. Then draping is the same on the dorsal recumbent position. I'll just get the draping. Letter D is orthopniec position. The purpose of these are for patient with difficulty in breathing, respiratory problems. So first is assist the patient sit on the bed or on the edge of the bed. Okay, ma'am? Then second is place an overbed table across the patient. Okay? Okay, ma'am? Then third is rest both hands of the patient over the bed table or pillow placed on it and lean forward. Then, for this procedure or position, there's no need to put drape on the patient. Letter E is prone position. So the purpose of these are for back massage, relaxation of the hips, and examination of the back. So first is help the patient assume the horizontal recumbent position. Okay. Then, second is to assist him or her to turn over onto abdomen. Okay, ma'am? Turn over. Then, third is place the pillow under the head and turn the head to one side. Turn your head po to one side. Okay. Fourth is place the arm at the side or extended upward. Okay. Then, fifth is place a pillow beneath the wrist and under the leg of the patient if she has to stay in the longer position. Okay, ma'am? Then, for the draping, it is similar to the dorsal position. Letter F is Trendelenburg position. So the purpose of these are in treatment of the shock or decreased blood pressure. Decreased blood pressure. Second is for surgical procedure on the abdomen or pelvic organs to replace the intestine from pelvic in upper abdomen. So first step is place the patient on his back at dorsal position. Second is to elevate the foot of the bed so that the leg extend upward at 45-degree angle. So head and the shoulder are lower than the hips and legs, and no pillow is required. Then, for draping the patient, it depends upon the kind of operation to be performed, and it is similar on that horizontal recumbent position. Letter G is FOWLER'S position. So the purpose of these are to maintain a comfortable sitting position, to relieve dyspnea, to facilitate drainage after surgery, as a preliminary procedure to allow the patient to sit up in a chair, and for inserting NDT. So first step is to place the patient in horizontal recumbent position. Okay. Then second is elevate the head of the bed approximately 45 degrees angle. So let's just assume. Then, third is flex on the knees slightly and support them with pillow. Then, last is drape as in horizontal recumbent position. H is knee-chest position. So the purpose of these are for expulsion of the air from the stomach. Second is to treatment for dysmenorrhea and for cord prolapse. So the first step is place the patient in prone position. Okay, ma'am, prone position. Then second is to assist the kneel with the knees slightly separated and bend forward so that the chest is resisting on the bend. Then, be sure that the thighs are perpendicular, then expose the part to be examined only. In draping, it should be covered, the back of the patient up to the extremities. Letter I is lateral position. So the purpose of these are giving NMS and colonic or irrigation. Second is examination of perineum, rectum, and inserting of suppositories. Third is for taking rectal temperature. Fourth is for change of position. Fifth is lateral position is a relaxing position. 7 is giving back care. So the first step is place the patient on his side with buttocks to the edge of the bed. Then second is flex both hands in right angle and place the pillow between the two hands. Then third is flex the anterior leg and place pillow underneath. Then next is align the patient in a good position and make sure that the patient is not lying on his arm or her arm. So fifth is support the body parts and maintain good alignment and comfort. Sixth is drape the patient in a supine position. Letter J is Sims position. So the purpose of these are, first is for the insertion of renal catheter. Second is digital examination of the rectum. Third is taking of rectal temperature. Fourth is OR procedure that involve the anus. First step is to let the patient lie on his left side. Okay, ma'am, your left side. Okay. Then second is slightly flex the left thigh and the right thigh, acutely flexed on the abdomen. Okay. Then third is the left arm is behind the body and the right arm is flexed according to the patient comfort. Drape the patient as in supine position.